We're going to get started, and I want to, first of all, thank Capstone for allowing these signings of 4 bills we got today that I think are going to radically improve customer care. And we're going to talk about the 4 bills. I'll introduce some of them. We're going to have some folks come up that were instrumental in getting these bills passed. And once we talk about each of the 4 bills, we'll sit down and we'll sign the 4 bills at once. Once we sign those 4 bills, those bills go to Juneau, then that becomes law. So at the signing and then the transmittal down to Juneau, these bills that we're going to talk about will then become law and be able to help a lot of Alaskans. So the 4 bills today would be SB 45, that stands for Senate Bill 45, Senate Bill 74, Senate Bill 75, and HB 126. That just tells where they originated, what house. They got to go to both houses, be approved in a majority vote, and that's what happened with these bills. And of course, we're going to be signing them today. The first one is SB 45, which is Direct Health Agreement, Not Insurance. And I'm just going to briefly introduce this bill, and then we're going to have folks come up and start to speak to it in greater detail. But basically, this legislation provides another option for consumers to have access to care. It's commonly called concierge medicine, and it allows patients and healthcare providers to enter into direct healthcare agreements, which is a contractual agreement between a patient and a provider for healthcare services, stipulating that the patient pay a flat fee, periodic fee, generally monthly, in exchange for routine visits and access to their healthcare provider. So, with that, I'm going to have Dr. Erickson come up, speak in some detail to this bill, and he's going to pass it on to others that helped get this bill passed. But I think this is going to be a great bill for Alaska. They're doing this down south. Sometimes we're a little slow up here because we're far away to get the information, but it's going to be good for everybody. And so, Doc, if you can come up and talk about SB 45, we'll get everybody talking about that, and then we'll move on to the other bills, okay?
A little taller than me. Thank you, Governor. I'd like to thank the small business owners that are here, the elected representatives, Director Winghire, and the individuals who are in need of improved access to health care, all present here today, and I thank you for coming. I'd like to say a special thank you to Senator David Wilson, and Representative Kevin McCabe for sponsoring SB 45 this past session. And I'd like to thank Senator Shelley Hughes, she's right over here. She was working on this bill with me for the past 4 years previous to this, and she was actually one of the first people to introduce direct primary care to Alaska in 2015. So a great deal of thanks goes to her as well. Capstone Clinic and Medical Network of Alaska, where we are here currently, we were founded to provide quality health care in as convenient and efficient method as possible. And we built a network of independent providers around ourselves to help support the primary care folks in order that we can provide more convenient and rapid care for our patients. So SB 45 is the culmination of years of effort on our part to continue that goal. And the purpose of this is to allow individuals and small businesses to access this type of healthcare payment plan that the Governor Dunleavy alluded to. So this provides improved time and cost for healthcare, which is really important at this point in time in our state when we've got high inflation, people are struggling to find ways to keep working and to save money. So by contracting directly with providers, employers and patients can have the most value, the least amount of cost, and the most transparency both for the payment of the services and for knowing exactly what services they're going to get for that payment. There's no better advocate for a patient's dollar or their health care than the patient themselves and working with their providers that they choose. So this SB 45 is a real common sense way that we can provide that kind of help. So direct primary care, as the Governor alluded to, has been around in the lower 48 about 10 years. It's in one way, shape, or form present in 45 states right now. So as he mentioned, we're a little slow to the game, but I think we can learn from others' mistakes. That's what I've learned by living up here, is that we just follow what they do wrong and we do it right up here the first time. So that's sort of my goal with this. As the governor said, it's typically in family medicine where this is the most commonly done. It's about $100 a month, and that provides you with an enumerated number of services that are provided in that particular clinic for your patient's needs. So that might be chronic care management, it might be your annual physical and labs, it might be minor surgical procedures, or telemedicine even. And so it provides just a lot of flexibility for the providers, because we don't have to bring you in necessarily to provide your care, which then opens up our clinic spots for other patients who need to be seen on that day in a much more efficient fashion. So if I can text you and answer a question that you have, that's included. If I can email you, or I can do a video call with you, all those touches that I have with a patient improve their care, improve my efficiency, and allow me to actually see the sick patients that I need to in the clinic, and for the amount of time that I need. So much more efficient for the provider, much more efficient for the patients. Imagine seeing your provider at work while you're taking 5 minutes out of your time to make sure that your blood pressure is controlled. Doesn't necessarily need to be done in a clinic. So this is a more efficient way of administering care. So until SB 45 was passed, this was only really allowed for large organizations, self-funded organizations, so a very limited number of people in our state that could access this type of concierge care. But now, because of SB 45, we get to offer this to small businesses and individuals as well. So direct primary care is not insurance. It's not a replacement for insurance. It is an augmentation of your high deductible plan or your catastrophic plan. And because of this, insurers understand that the cost of care is reduced when you have increased access to primary care. And so they in turn reduce the premiums for your catastrophic plans if you have these DPC arrangements already in place. And this can be substantial reductions in the amount of money that a business or an individual will have to pay for their insurance. So because of this, employers and individuals in lower 48 are accepting this method of payment or this method of care in record numbers. It's the number one fastest growing form of sort of health plans in the lower 48. And we're excited to be able to offer this here this coming year in Alaska. With that, I think I've explained it pretty well. I will turn it over to Senator Wilson, who was very instrumental in bringing this home this year, and I really appreciate all of you guys for coming, witnessing the celebration of our years of hard work and efforts, and also for celebrating just the reduced costs and increased convenience for our patients. So with that, thank you very much.
Hello everyone, I'm Senator David Wilson, Senator for this wonderful District N, and if you haven't already spent the time in Wasilla, welcome to the land of freedom. Direct healthcare agreement has been a journey. Our office has worked on this bill for the past 2 years, but other offices, as Dr. Erickson said, like Senator Hughes, has worked on this, and this bill has taken probably about a 12 to 14-year journey to completion. Senate Bill 45 changes how unclear the law now allows the clarity for providers to enter into direct healthcare agreements for primary care, as Dr. Erickson explained. We would not be here today without the hard work of Dr. Erickson and others that have testified and submitted written and verbal testimony for this piece of legislation. And I also want to thank him for opening this space today for this signing. Of course, we have to thank our esteemed Director of Insurance, Dr. Wing Heyer, who is a trusted resource in the building in the Capitol halls of Juneau, and invaluable in explaining the nuances of insurances and the clarity of this piece of legislation that's going to be signed today. The time providers spend with patients can now be used to maximize and by removing this bureaucracy. We're doing this by signing this bill today, and I also want to thank Ms. Jasmine Martin, who also helped champion this piece of legislation in our office and work through all the offices. Let's give her a big round of applause. And we also couldn't be here today without our champion in the House, Rep. McCabe, who's going to be coming here next. I just want to also thank him for his hard work and steadfast and going through multiple revisions in that body, but he got it across the finish line. Also wouldn't be here today if it wasn't for Rep. McCabe. Thank you.
Thanks so much. Yeah, this bill was a journey. It was an education for me and for my office. And once again, Jasmine and my Chief of Staff, Angela Steffel, worked tirelessly on this bill because we firmly believe that this is a giant step forward for Alaskans in reducing costs for health care, especially in the Valley. Full disclosure, Capstone is my medical provider here, and I've enjoyed every minute of being here, and I look forward to doing this many more times under a direct health care plan. One of the things that was really important to me with this bill was the fact that we get doctors and nurses back to caring for patients instead of coding for insurance companies. And to me, that is the ultimate with this bill, is the doctor-patient relationship, and frankly, the insurance companies like it because you get to go to your doctor more often and less of a chance of having to go to the emergency room with some sort of chronic thing that has been plaguing you for months. Instead, you call your doctor, as Dr. Erickson said, maybe have a telehealth consultation and maybe come in, and you don't have to worry about it. You don't have to worry about where's the money going to come from. I think this is a fabulous bill, and I really appreciate Senator Hughes and Dr. Winghire, and as well as Dr. Erickson for bringing it forward. With that, I think Director Winghire is next.
Good morning. There's no doubt that this bill has been worked on forever. I think I've been in this position 10 years, and I think we've touched it every year trying to get it across the finish line. I urge everyone who is now looking at renewing their insurance for 2025 to consider a direct health care agreement as you're pricing your insurance. We see it as you being able, as an employer or an individual, being able to take a higher deductible and truly using your insurance for catastrophic losses, but allowing this bill to fill the gap of when you have a child with strep throat, when you have a child that has a fever and you don't want to take them to the doctor because you know you're going to have to pay it because you've got a $10,000 deductible. This bill will address those situations. If it's you just want your blood pressure checked, this bill will address those situations so you're not paying out of pocket. It's a good time to start talking to Capstone and other providers that may be offering direct health care as you look at renewing your insurance for 2025. It's not effective to January 1, but there's nothing to stop the conversations now. I appreciate the support we had in the House, in the Senate, Senator Wilson, Rep. McCabe. There were a lot of conversations to get this bill across, and I think we will all benefit from it. It helps us in our quest to have health care affordable and health care accessible. And with that, I thank you for coming today. Governor.
I guess now this is our opportunity to change gears here and start talking about House Bill 126. A piece of legislation is near and dear to my heart. We got a lot of folks in this room here who have worked really hard on it. First off, a man who has been in every branch of service until the Space Force, Mr. Brian Webb. Thank you, Mr. Brian Webb. So also, Ms. Rachel Gunn, I want to thank you so much for working so hard, running this bill down, walking through offices, speaking with folks, and getting things done. And Madam Speaker, also thank you for helping me get through this. I really appreciate you. Next, I'd like to thank the governor. And so this piece of legislation, it has 4 different components to it. The first component I want to talk about is the introduction of licensing for associate counselors, which expands our mental health workforce, which is going to be outstanding. It's going to help folks clear the backlog. You won't have to wait 6 months for an appointment anymore when it comes to mental health. and especially in rural Alaska and also in underserved communities in Alaska. It also broadens telehealth access, making it easier for Alaskans to receive health care in their home. Additionally, House Bill 126 strengthens patients' rights by increasing transparency in healthcare services and costs. And it also provides essential protections for EMS professionals. So, House Bill 126 ensures that every Alaskan, no matter where they live, have the opportunity to receive quality health care. So thank you.
Hello, everyone. The other two bills that we hear today are SB 74 and 75. These are the interstate compacts for speech pathologists, audiologists, and physical therapists, and physical therapist assistants. These are one of the first interstate compacts to be enacted here in Alaska. These bills took a huge, massive effort and parties. And there's a lot of whole list of folks here to thank, and so be quickly here. These organizations provided incredible testimony, real-life examples of how these bills, with their passage, can help increase direct health care access to Alaska and help our workforce shortages areas to get providers licensed faster within the state. Unfortunately, again, I may not miss a few folks, but first we want to thank the Department of Defense and their coordination with the Council of State Governments, especially Ms. Tammy Perot, the Northwest Regional Liaison, who's here today. We also have the Speech and Hearing Association, especially Nancy Leverling, who testified in each and every committee. We have the Alaska Physical Therapy Association with Dr. Leanne Carruthers, who's here in the room, and Alec Kay, who spent a lot of time and testifying on their phones, also missing some of their patient visits as well as they're trying to testify. So we want to thank them. We also have the staff at DCCED, especially Glenn Slavers and Sullivan Robb, who's also here today, to answer lots of questions on these bills because, unfortunately, and I'm going to say something that's probably not popular, a lot of my colleagues, including myself, we're inquisitive idiots. And sometimes we ask a lot of questions to get down to the root of situations. Both the Alaska Speech and Language Hearing Associations and the Federal Board of Physical Therapy and AARP, Ms. Marge Stoneking, who's also here, and also Mr. Dave Parrish, who helped wrangle all these cats and get them in the room to testify, and what times, because a lot of hearings had a lot of times I kept switching, and just how the sausage is made. And I'm sorry if I left anyone out, but I just want to thank everyone who's here today to help increase access to health care, help lower the cost of health care with all four of these bills, and especially with the governor and allowing his wonderful staff and being here and having his administration being supportive. I know we also have two commissioners also here in the room too, the commissioners of health and and the director of health, commissioner of health, and the commissioner of family and community services, Kim Colville and Heidi Hedberg are also here. So let's give everyone a round of applause. And with that, I'll turn this back over to the governor.
So as we're getting ready to sign all four bills. Again, I just want to thank everyone that was involved. Commissioner Hedberg, Legislative Liaison Courtney Enright. Where are you, Courtney? Over here, okay. Again, all the legislators that were involved, all of the professionals, the doctors, the organizations. As was mentioned, it takes oftentimes a big team to get these bills over the finish line. But in the end, I think we got four very good bills that are going to help Alaskans, and that's really what this work is all about. How do you help Alaskans? And I want to give credit again to the legislature for taking these bills seriously, getting them over the finish line, and allowing us the opportunity today to sign these bills into law, which we're going to do right now, and get them down to Juneau so that we can make sure that these bills are implemented ASAP. Okay, folks, so the first bill is going to be SB 45, and we are going to get that signed now. So with the signature of SB 45, what they refer to as concierge healthcare approach can now take place in the great state of Alaska. Our next bill is SB 74, Physical Therapy Compact. And with the signature of this bill, we're going to be able to do more work with our great physical therapists here in the state of Alaska and help many Alaskans. Terrific. SB 75, Audio Speech Compact is next. So with the signature of this great bill, the process of helping more Alaskans through the process of our audio and speech professionals with this compact will now take place. Is this 26? 126. Can't read your handwriting. Yeah. And the last bill we're going to sign today is HB 126, and it's entitled Associate Counselors. And with the signature of this great bill, we can again reach more Alaskans, do great work in assisting Alaskans through the, this new bill that's going to be signed into law regarding associate counselors. Awesome. So with that, 4 terrific bills through a lot of hard work, the folks behind me and many others that aren't here today. But we're going to take a couple pictures to represent these 4 bills that we signed here today, and I want to thank everybody once again. So this is just the beginning, folks. We're already going to start the process and working on some more healthcare initiatives for the upcoming session. So you'll probably see us back here again with some great bills going into next year. So I want to thank everybody very much. You guys want to take pictures here?